Africa's healthcare sector is entering a new digital era. Governments and institutions across the continent are adopting artificial intelligence, telemedicine, mobile diagnostics, and digital public health systems to expand access to care and improve efficiency. This is China Africa Talk. I'm Gao Junya. The recent World Health Summit Regional Meeting 2026 placed digital transformation at the center of discussions, with leaders emphasizing that technology is becoming essential for building resilient healthcare systems and achieving universal health coverage. So, how far has Africa's digital health transformation progressed? And what role can new technologies play in addressing long-standing healthcare challenges across the continent? My colleagues Jerry O'Willie, Douglas Akwach, and Danielle Arapmoy examine those questions.
And I'm going to jump straight into it, Danielle. Nairobi hosted the World Health Summit 2026 regional meeting, and that came between April the 27th and April the 29th. Leaders, innovators, and change makers came together to explore solutions that strengthen Africa's health systems and advance global health progress. You were present at that summit. You gave us some reports from that summit. Was there anything that really surprised you from the discussions that went on there? A practical solution maybe, or a warning that felt really close to the ground for you?
Well, Jerry, this was a big moment for Africa, for experts, innovators, and healthcare leaders from across the world to meet here in Nairobi to discuss matters health. And for a very long time, Jerry, rules about healthcare system in Africa was made by some countries outside the continent. Now, this time the leaders came up to say that we need to be in the driver's seat, not behind. We need to be in the driver's seat. We need to take charge. We take lead of Africa's healthcare system. And here, they discussed specifically one area that I thought was very, very important for Africans to take it seriously: health sovereignty. And what that means is that Africa now wants to take charge of its healthcare system. Not like in the past where everything has to come from the World Health Organization. Leaders have to discuss from outside Africa and decide for us as Africans and then bring those rules here to lead our healthcare system. So this time the leaders are saying that we need to do it ourselves. We can't wait for the Western world to discuss health matters in Africa. And yet we are right here. We have people who have gone to school, who have studied medicine. So they're saying healthcare sovereignty must be number one in Africa. And one thing that they did that amazed me, that I actually thought that was very important, they decided to form up a committee. And this committee is meant to train healthcare managers so that we have it at hand, that yes, we have our people who can actually decide on healthcare matters, not wait for the West to do that. And another thing that I thought was very important was that they came up with what we call a new neighborhood watch. And that neighborhood watch is actually going to be under Africa CDC. And that will be based here in Nairobi. So Nairobi will host the regional hub for CDC Africa. In that if anything breaks out in Africa, this regional hub will hold 14 African countries within the Eastern African region. It will be like one command center for this region of East Africa. So in case we have an outbreak, these leaders will come and say, okay, what do we need to do to respond very fast? What resources do we need? What policies do we need to tackle this disease that has broken out in this region of Africa? So Kenya is going to take a lead in that, which I thought was very, very important indeed, because in the past, every country is going it alone. Because this is all coming from what we experienced during COVID-19. That COVID came and every country was struggling to handle COVID-19. We didn't know how to handle this disease. It just came abrupt. So a lot of our people died because we are all fragmented. Everybody is trying to say, I'll handle it as Uganda, I'll handle it as Kenya, as Ethiopia, Namibia. But now this regional block, this hub, will come in place and say, if anything happens within this region, we shall respond very fast. So that is what Kenya will be doing, which I thought was very, very great indeed for these leaders to discuss that, Jerry. And another critical area that has been disturbing so many African leaders, including us journalists, is the question of paying our own way. For a very long time, Jerry, our healthcare systems have been dependent on donor funding. If you go around, majority of healthcare centers are funded by either USAID, European Union. So it's been limiting African countries. Our healthcare system have been struggling because we don't care. This money comes in big chunk, in big bulk. And sometimes people can get, tempted to utilize this money in any way that they want to. So they're saying that Africa need now to take charge of that we need to change that perception that we can produce our very own within this continent because we have the resources. We have, trees that we used to take as medicine. When we are young, that we can harvest this. Traditional medicine can actually work in Africa. So they're saying African countries now must begin to tap within local resources to finance African health system if we need this to change. Because if you have contributed your own money as a country to finance your health care, that will make you utilize it in a proper way. But free money that is given to you has got issues. Sometimes it's too sweet. You'll be tempted. You get corrupted and utilize this money in a very, unwanted ways. So if Africa can do that, well, still Jeremy may say that, there is saying that we need to do this, but there's also doing it. Yeah. So yes, we can. But also another challenge that I saw that leaders did not talk about is the question of Africa's priorities. Because every single country in Africa has its priority. Budgetary allocations are based on countries' priorities. What is Kenya's first priority when it comes to budgetary allocation? What is Uganda's, So some countries take, for instance, infrastructure development as their first priority. So when they're budgeting in parliament, that is the first issue that they will look at, allocate huge sums of money. Other countries like Uganda, security is their main priority. So health is either number 3, 4, 5. So that perception has to change, that we cannot have, any country can never develop with a sick population. So we first need to make our population, healthy enough, and then we can do other things. So those were some key takeaways that I thought were very, very great. If only these leaders can put these things into action, then we can move on as a continent that cares for its healthcare system. But if we are going to speak in big conferences and do not have concrete, action on the ground, there's going to be a problem for very many years to come. But health must be number one priority, because security people have to be healthy. The entire population has to be healthy for any country to grow and develop.
You put it very clearly and in a very, very understandable manner, Daniel. Of course, you were there. It was a 3-day summit that was happening here in Nairobi. And let me just mention that the theme for this summit, of course, was reimagining Africa's health systems. And this includes innovation, integration, and interdependence. And what you're telling me right now touches on those bits. Trying to find innovative ways so that Africa's health systems can move forward, can serve the people in Africa at the capacity that they're supposed to be serving these people in Africa. And part of the discussions there were also how we can then involve innovation and digitize Africa's health systems so that then the continent is not stuck in systems that ideally should have served this continent probably 50 years ago. Going forward, what is it that we can make use of in the best way possible in terms of emerging technology that can help our healthcare systems? And Douglas, I just want to just a bit drive this conversation to that direction, digitizing healthcare systems in Africa. Now, digital health is no longer just the future. It's something that is already happening. We have seen other regions in the world already taking this up. We have also seen examples from within Africa of instances where healthcare systems have been digitized, whether it comes to data collection and storage, whether it comes to health professionals relating with patients. We have seen some of these instances already being available in Africa, and it is already making a contribution to that sector. From telemedicine, AI diagnostics, we are already seeing more and more countries going that direction. What is your assessment of where the continent stands so far in this matter?
Thank you, Jerry. Interesting listening to Daniel's very great insights on the summit in Nairobi. Of course, it was a historic moment for Kenya, the region, and of course, Africa as a whole. Now, I think technology is not a question of if or when. because it's right here, and it's been here for quite a while now. And I'm particularly happy to have lived analog health, and now I live digital health. And it's interesting how digital health or digital health devices or gadgets are transforming the way we consume health services. Because many of these things are portable. You can carry them. And of course, they also give you an opportunity to access health services virtually outside the institutional, frameworks that we are always used to. So you talk about even wearable devices, like the watch you are wearing. It could be more than just a watch. It could be measuring your heart rate. It could be measuring your blood pressure. It could be about blood sugar. So some of these things are wearable. They have got sensors that actually track your physical activities. So you are constantly aware, sometimes health was an issue of, oh, I'm not feeling well. I feel my joints. I feel headache. But now technology is making health something that we are constantly aware of through these devices. And of course, we also have AI, artificial intelligence, controversial, but very, very useful. Up to this point in time, we are still trying to develop policies on how to handle it. So a bit of caution, but of course, we realize the usefulness of artificial intelligence in, for example, analyzing massive data sets that then identify disease patterns, spread of diseases, particularly when you talk about diseases like COVID, diseases like Ebola, that are common, in parts of Africa that keep breaking out. So this also helps in not just tracking diseases, but also in documentation. We know the use of artificial intelligence in developing documents, developing medical records, and of course, personalized data. So this is an area where we are realizing a lot of transformative change in terms of providing and consuming health services. Then, of course, we have these mobile phones. And I think you'll be coming to that. I did watch this show on the summit Daniel attended, and there was this young man who was on a panel here. And it's basically a software engineer. And he was talking about a software that now enables mothers in rural areas. You know how difficult rural Africa can be. This gadget can now enable mothers in rural Africa to access midwife services, the nearest midwife service. So it's like a gadget that connects expectant mothers with the nearest midwife services. In rural Africa, sometimes the nearest health center could be 50 kilometers away. And sometimes these things happen right in the middle of the night. So technology is changing this through mobile data devices, mobile data applications. And of course, you've already talked about telemedicine and telehealth. And of course, this provides immense opportunities, particularly of specialist services, where, for example, doctors at Kenyatta Hospital here in Nairobi can work together with specialists, not based here, but probably in some capital, maybe in Delhi or some other, capital. Through the guidance of that specialist, doctors can do surgery using these procedures. So this is really important. The key to this digital transformation is really data. So data is a big thing and just as controversial. And you might remember that in the recent few months, particularly in the African continent, data has been a big issue with regard to how, for example, the America First policy and how America prefers to engage with African countries and where it made the request for data and the sort of controversy this kicked up. So it's a whole range of transformation we are seeing as a result of digital services. However, we must never assume for a moment that everybody's on board. Even as technology carries many of us forward in Africa, it still leaves many of us behind. And I think these are some of the issues that you will talk about as we continue having this debate. So there is a gap, and a very critical gap, where even access to devices, owning and accessing devices, even questions about electricity, questions about connectivity, not just to the grid, but also to the internet, are leaving many Africans behind, even as we begin to enjoy these transformative changes that are being brought about by these digital health services.
I like the points you guys have already brought up. And I want to give you particularly something that I've lived through. You are talking about living through the analog system, and now you are also
digital.
part of the digital system.
Yeah.
When I was young, I think as a little boy, I remember going to hospital, and I think this happened across all the Kenyan hospitals, Daniel. And you'd go to hospital. For a doctor to capture your details, you had to go buy an exercise book. And you had to go buy an exercise book, and they would actually split it into two. So they'd give you just the lower half or the upper half. And that is what captured your data. And you had to keep this book with you for the entirety of, if you're going to need to see this doctor probably for 2 years, you will always have to come with this book to this doctor. And it was that important. But also just going even beyond
that was called cost sharing. Daniel, I don't know if you have something like that in Uganda.
Do you have something like that, Daniel?
This idea of cost sharing is where we began getting it completely wrong.
Yes. And now that you talk about that, now the other thing that I don't know if you also have such memories, Douglas, but our hospitals back then, Daniel, one needle would inject probably a whole village.
It was heated.
So
it was boiling.
The doctors had a stove somewhere where they had hot water, and that hot water was our sterilizer. So it would be used on Jerry, and once I leave, I came in with malaria. They take the malaria drug, they inject me, they drop it into the hot
Jerry,
water.
you're a true analog, eh? You're a true analog.
How safe was that?
So, well, cannot really say it was safe. I don't think we can say it was safe, because even the sterilizer, remember, is just water. So they just heated it, and they would throw those needles back into the water and then just use it on someone else. So I'm curious, Douglas, because I know you know this story. So when you see such discussions already happening and people trying to get Africa to, digitize their systems, data collection, data storage, how we are going to operate going forward, do you feel optimistic for what lies ahead in this sector for the continent?
Yeah. Of course, cautiously optimistic. Of course, in Africa, we always have caution. I think we are blessed in many ways. Wonderful weather, wonderful climate, but there are also a lot of vagaries. I think this links with what Daniel has just talked about, and it's more about African-led solutions. We always talk about African solutions for African problems. So as Daniel pointed out, I think one of the a key rallying call at the summit was sovereignty. So he has already talked about initiatives that were launched, which I think wants to drive this agenda. And if I check here, I can see that one of the things that was launched was called African Health Leadership and Management Committee, AHLMC. And this is the work of CDC Africa, which is a major shift really toward self-governance, because we are talking about sovereignty here, and reducing reliance on external financing. So this African Health Leadership and Management Committee is going to look into the issues of cutting dependence, this excessive reliance on external financing. Then at the summit, there was also the issue of the architecture of implementation. And Daniel and Jerry will agree with me here that we do have beautiful strategies, beautiful policies. But the missing link always in Africa's biggest challenge has been one of implementation. Just a short while ago, I was having a meeting where we were talking about security and conflict, and we were just wondering, is it that for 20 or so years this sort of conflict has been going on, and there has not been debate. Probably there are debates, there are solutions, there are recommendations, but the reason we keep going in cycles is because implementation doesn't happen. So the summit, I think, the summit president, Professor Lukoya Atwoli, is that the correct name?
Yes.
Yeah, captured the mood perfectly by stating that the continent is moving from being a consumer of global health policy to what he calls a co-author. So we no longer going to be just standing by, but actively participating in making policy. So from consumer policy, policies are just pushed to us, sometimes totally not in context with our real realities, our situations, but they are pushed here anyway. So we are going to be at the table now where health policy is discussed, where health policy is designed. And I think that is really important. Then, of course, there is also what we call the digital integration. And I think Kenya used this opportunity very well. Of course, it was in the capital, Nairobi, at the UN, and launched its own digital health strategy for 2024-2027. Now you can see how digital, is important. It's already in national health strategies. So these things give me optimism. They give me hope. Of course, there is also the regional security aspect. And Daniel, because you are there, understand an agreement was reached where Kenya is to host the Eastern Africa Regional Coordinating Center for this particular region, which will serve 14 countries and strengthen regional emergency response. Response is a key thing. And of course, I think reflecting really in retrospect, if you look at the doomsayers and the story of COVID in Africa, and I think what later emerged was that the wrong modeling, the trajectory of the pandemic was modeled on its trends in Europe. And that model was used to predict its trajectory in Africa. I think they got it completely wrong. Of course, there are many other factors that contributed to COVID having a totally different. Of course, it claimed many lives.
Some people actually question why is Africa? Why are we not seeing the numbers we expect?
So this is really why, if we have our own emergency response systems, our own emergency modeling methods, then we can easily predict our future. However, the reason, and I think delegates at the summit observed this one, the reason we are cautiously optimistic is because at the moment, the financing gap in the health sector is huge. I think we just lost about $31 billion in official development assistance. That reality fuels a unified push, towards domestic financing. It tells us that money is no longer there, but that hole has to be plugged.
And that is
so in short, yes.
70% of our healthcare system was lost. 70%.
70%.
So it's only 30% that is left.
So
you can imagine.
So even as we remain optimistic, and Daniel reiterates this through that sort of data, we remain cautiously optimistic.
Daniel, looking at all these things, what's the reality in Uganda when it comes to the uptake of innovation and digitizing the health sector? What's the reality in Uganda so far?
In Uganda, we're not as bad as other countries, I must say, because we have a lot of young people that are beginning to innovate within the healthcare system, and that is helping to reach to local villages that never had all these services, brought closer to them. We have what we call, I think this is one of the common one that we have right now. It's called Rocket Health. So Rocket Health is a technology, that was developed by one of the Ugandans. So what it is that people have, of course, mobile phones. We assume they all have mobile phones in villages and everywhere else. So you simply dial 8080, and then you can talk to a doctor. So you can explain, to the doctor via, WhatsApp call or just a call to a doctor. And then the doctor will diagnose your problem. then they have a mobile clinic that will bring the medicine to your doorstep. So you don't have to move all the way from a village in a Kokoro to come all the way to Kampala to see a doctor. Yeah. And many other young people are doing that in different platforms to try to reach out to people, something that was not there in the past. Like now my grandmother can be reached, just by phone call. They ask you, what is your problem? Speak to a doctor, and before you know, medicine has been brought to your doorstep. So it is moving progressively. But again, we still have the problem, just like Douglas mentioned here, the question of infrastructure. How do we have the infrastructure that can, coordinate all these innovations that we are having today? So unless governments come with a clear structured policy, to say this is going to be our objective, this is what we want to achieve at the end of the day, so that our people can have access to healthcare, universal access to healthcare. This is something that, yes, the government is trying to do, but it still boils down to, the implementation, just like he said earlier on. Implementation is still a challenge to many of our healthcare system in Uganda.
It is. And in Kenya, I think we have something similar with what Daniel is actually talking about.
I actually wanted to add, if you look at policy, I think Uganda is very strong because they have now what we call the National Health Information and Digital Health Strategy Plan. Then they also have a Digital Health Act and guidelines. So when you see a country move towards the policy direction, always tells you is a clear indicator the direction the country wants to take, and this really actually confirms that Uganda is moving ahead. And even looking back, one of the success stories of East Africa during the HIV/AIDS pandemic was Uganda.
Yes.
Uganda is the one that broke the barriers while everybody was still suffocating under stigma. And so Uganda has really showcased itself as a leader, when it comes to dealing with health emergencies. And I'm not surprised, therefore, that even in digital health, with now technology, they are taking a lead, and they have got very strong policy direction. Yeah.
And right there neighboring Uganda, Rwanda, if you're going to talk about countries that have really gone big on digitizing health, I think Rwanda has done a really good job. And we have even seen stories of some health professionals, even from other regions, Europe and beyond, coming to Rwanda to benchmark, to see what is it that they're doing, what are these policies that help this country be so strong in terms of health. Because as it stands, more than 86% of Rwandans are covered by universal health care in the country, and that is something that has been initiated by the government. And we have seen stories of Rwanda even deploying drones to deliver medicine. They also have something similar to what Daniel was mentioning earlier, where you have mobile clinics that can be able to reach people in regions that are, far out or really hard to get out of, especially if you're a patient. It would be easier to bring a doctor to you than to take you to a doctor. They have done a couple of things that I think would be commendable. And I was just mentioning earlier, in Kenya, we have something similar to what you mentioned. In Kenya, we have, I think there's a service called My Dawa. That would probably be the most popular one, where you're able to just over the phone talk to a doctor. You can get access to a doctor, and you can get healthcare information. You can give them your symptoms. They can give you recommendations on how to treat the symptoms that you have. Even as if they feel like you need more tests, they will send a mobile clinic. People who will come in motorbikes already with some of the test kits that they're able to use to diagnose you and to test your blood probably, and give you results probably in some period of time. So they also give you advice on treatment. They prescribe medicine for you, and they also link you to home care services like the lab tests, family planning, and all these things. So I think getting some of these examples from Kenya, from Rwanda, from Uganda, and other countries, I think it's a step in the right direction, guys. I think it's a step. It already proves that as a continent, we are moving forward. We are not just remaining behind there. But, and I want to leave this open to any one of us here. What are the biggest wins technology has brought to healthcare in Africa? What are some of the biggest wins, something that stands out for you in terms of Africa incorporating technology and innovation into its healthcare sector?
Yeah, I think something that I just read recently, but someone was saying that AI has actually brought some excellent technology across Africa. Someone can be sick in his house, and then AI will ask you, "Give me the symptoms. Yes, what symptoms do you have? I have cold. I have aching feet, yeah, for instance." And then it will tell you that this is what you're supposed to take, as medicine. This is something that is amazing. In the past, you get sick. I mean, you're feeling cold, you're trembling, headache, and you don't know exactly what's happening to you. But now you can actually use AI to ask these questions that AI, I am feeling this and this ABCD, what medicine can I take? And sometimes AI will give you the right prescription, kabisa, and then you go to the doctor, you explain again, and say, this is what I'm feeling. And it's exactly what AI told you. So this is a plus for me in Africa. That in the past it was very challenging. Someone can be sick and die even without seeing a doctor or even speaking to anyone. Yeah, but now with AI innovation that have come on board, people are able to get access to these health questions that for a very long time we've been missing in the continent.
Yeah. Very interesting. I think you already mentioned two very interesting things. One is the drone, and Rwanda is the poster boy, if I may, of drone technology and its application in the health sector in Africa. Everybody talks about Rwanda, and of course you have also mentioned bringing the doctor to you, or you going to the doctor. So maybe I'd like to use Kenya's very popular term of last mile. So the logistic nightmare for Africa, and when I was giving the example of the expectant mothers, I was talking precisely about that. So this is where technology is going to save, potentially will save many Africans, because the connectivity, the infrastructure, the road to the hospital, sometimes there are roads to nowhere. Yeah, so where roads are poor or non-existent, like even when you talk about the Rwanda drones, you're actually talking about drones that deliver supplies in areas that are generally not very easy to access. Rwanda's terrain, very mountainous country. So technology has literally taken away the challenge of infrastructure. How do we get to hospital as quick as possible? So it brings the doctor to your home. And of course that Rwanda delivery. And then now we have a supply chain visibility where we have Africa Medical Services Platform and tools like InTrack in Uganda, which allows real-time, tracking of medicine stocks, recording, tracking of medicine stocks, reducing wastage, and ensuring that rural clinics don't run out of essential drugs. I hope this is really practical and that it is not something we are reading in literature and
in Uganda we actually have a system where government drugs are actually labeled government, so you cannot sell it like in public places, private.
So it's tracked, yeah. So also things like financial inclusion, mobile wallet, mobile phone. Sometimes one of the biggest challenge in Africa for people who are seeking healthcare and health services has been high out-of-pocket costs, that prevent people from seeking, care until sometimes it is too late. So this technology, mobile money, has turned into a health wallet. Like a phone call, will quickly enable you, using mobile to transfer money to assist. Then things like M-TIBA in Kenya. This is a platform that allows users to save, send, and even spend money specifically for healthcare. And the app is there. Then we have digital reimbursement tools like Maisha Meds. There are so many, Jerry. There are so many. So, and even the idea of doctor-patient ratio. We talk about one doctor to almost 3,000, Daniel. And the question then has been, so then how does one doctor really, realistically, in practice, serve 3,000 people? It's almost impossible. But you find that technology, of course, we are worried about, we hope technology is supplementing and complementing and not trying to replace. And I think this was an observation at the conference that In as much as we use technology, we are not trying to replace the doctor. So these are really, really big transformative changes that I see technology has brought about. And even the idea of early detection. The fact that you can actually be walking and you are constantly aware of your blood pressure because of either it's either your phone or your mobile it's either your mobile phone or your wristwatch. It keeps telling you, so you don't end up in a situation where your blood pressure is skyward and you are not aware. So technology is enabling us to now be very health conscious, like I'd already said, that things that would necessarily cause a threat to our lives, we can now be quickly aware of them in good time to seek help. And then, of course, even the idea of mass screening for things like tuberculosis is now being made possible by technology. But again, I want to add that still in all this, it's data, Jerry. It's data. Still in all this, it is data, which is why data is the beginning, the middle, and the end of this journey we are trying to make in technology. So for Africa, in sum, really, I think there have been major wins. And we remain, again, optimistic that Africa will continue forging forward in this direction.
There is capacity building, which is really, really important if Africa is to succeed. But then we also need to look at another angle here, which is literacy. How do we then narrow those gaps to ensure that this digital or digitizing the healthcare systems in Africa works for everyone and not just a select few? Let me start with you, Daniel.
Jerry, I think we need to have, as African governments, Africa needs to have a deliberate policy. I'll give you a very good example. In China, when I was in China, I saw a program that really amazed me. I was like, this is fantastic. That the Chinese care so much about their old people that they have classes for senior citizens on how to use emerging technologies. This is something that I was so excited about. I was like, wow. So nobody is supposed to be left behind. Whether you're 70 or 80, as long as you're still alive, you have to have access to all these new technologies. So they conduct classes in every city, at least. Beijing had a big one with very old people. I was like, this is new to me. Because they have a deliberate policy to ensure that everybody is brought on board, be it in health, be it in other services they can access. So elders are trying to, use a deep seek, to search for stuff, at that old age. So Africa needs to have such kind of policies that, yes, we have senior citizens who were born way before this technology, came on board. So they are old, but how can they be included in this new technology that is driving services to everybody across Africa? So if we could have such classes, such lessons to our people, so even the illiterate will be able to feel that they are being included in the development of the country.
And Douglas, of course, the challenges are vast, because even if you're going to talk about some of our populations here in Africa that are not literate or technology literate, there are also other challenges, whether it's electricity penetration, whether it's poor patient-doctor ratios, as you were mentioning earlier, poor financing, because that's also a big issue. And Daniel brought that up. Only 30% remains for us now to navigate through and build Africa's healthcare systems. Considering all these things and also the continent's current economic capacity, what is the way forward?
I think this is where on this one I'm really optimistic for Africa, because just look at the median age in Africa. I think Africa has when you talk technology, really, you are talking young people. And this is where Africa has its, if I may say, comparative advantage. It's a largely young continent. I think that is really, really key. The other most important thing that we need to do is to invest in education. African governments must invest in education, because education is the key to unlocking literacy. Of course, again, when you look across the continent, these levels are different. There are some very highly literate societies in Africa. They are averagely literate, and then, of course, there are those ones that are very low. And then the other thing here, Jerry, for me and Daniel, I think is language. The challenge we have with these technologies is language. How much can we then indigenize these technologies? So we need to think about making our own local apps, using our own languages. Of course, we know that AI can translate many local languages these days. So language is a factor. These apps must be local. And then the other important thing, the way forward really, is that the data sets we are using at the moment to analyze, to understand, to break down information, these are not data sets originated in Africa. These are foreign data sets. And I think there are concerns in some circles that wrong interpretations can be reached because the wrong data set was used to read, to try to understand, to analyze a case, a situation. So for me, for Africa to move forward, we need to invest in those things. But I'm very optimistic because the continent is a youthful continent. We have very many young people that drive this particular area.
Let's get into the point of data privacy. Daniel, was this part of the Nairobi discussions by any chance?
Data privacy, data privacy was not key among the agenda, but I had the opportunity to speak to the DG Africa CDC about the same question of the United States America First policy rather. He said that yes, there's been a lot of concern among African countries for the US trying to have access to Africa's healthcare data. They are saying we are coming back again to the question of sovereignty. He's saying that this cannot happen, that Africa must take charge now, not tomorrow. So he did mention that it is a big challenge. A lot of countries have now signed. I think about 12 African countries have signed to that deal with Trump. And he mentioned that he's meeting with all African ministers of health. Okay, they'll have a meeting and then they will proceed to meet with with US officials over the same, because they want to know how this deal was reached to access Africa's data in health. And who cracked the deal anyway? And why do we need to, give out our data to the United States? So it is a big question. It is a big concern for many African countries, especially, those that pulled out of the deal. They're saying it is actually treasonous to some countries. It is private data. How can you give it to another country? So they're saying that this must be clearly stated out, spelled out. Why does America need? So I do feel that Africa must take charge. Otherwise, this data can be used against us, in the near future.
We're going to rely on our experts on that to try and really cushion the continent from any exploitations that might be attached to some of these deals that are coming in. Of course, I'm going to wind down now, but I just want to know, very briefly, Douglas. So are you confident that if we went to the village right now and we were selling this idea of using telemedicine to our grandfathers, are we in a better position now to convince them to take it up?
Yeah, I'm very confident because if you look at rural populations in Africa, and M-Pesa is a very good example, that the single most important gadget, app that rural people have is M-Pesa. Now, because that is where the money transaction happens. It's the money transaction, single most important money transaction platform. Now, in that same phone, which is usually a small tablet phone, they can have a health app which is linked to M-Pesa. So they can actually buy medicine from M-Dawa app, let me call it that. Using their M-Pesa, they can go to M-Dawa app, they can go to M-Doctor, M-Tiba app in that same phone. So I'm very convinced rural people in Africa are using these things already, Jerry. So it's not a question of convincing them. It's a question of just how much can we upscale what they are already using. So for me, it's about upscaling what's already happening, not beginning from zero, Jerry.
The next time I'm there, I will give you feedback. That is going to be my job the next time. I'll give you feedback.
Africa's digital health transformation is still evolving, but momentum is clearly building. More and more African countries see innovation as a key pathway towards stronger and more independent healthcare systems. You can find more of the discussions on YouTube and Spotify. Search Talk Africa Plus. That's it for this edition of China Africa Talk. I'm Gao Junya. Thank you for listening. Bye for now.